Hey there, it's Dr. Cammisa. Welcome back to our video series, and as you can see here, I'm by the circuit panel. Everyone's seen this in their house. It's somewhere in their house. And so I'm going to share today my analogies, my metaphors of how this relates to our spine, how this relates to our health. So stay tuned. I got a lot to share. If you're new to us, hit the subscribe button to us or for us. Hit the little bell notifications and give us a thumbs up. This is going to be a good one. Stay tuned. Hey there, it's Dr. Cammisa. Welcome back to our video series. And as you can see today, I'm actually standing by the circuit panel in the basement. And so, why am I down here? I like to keep things simple. I like to give analogies. The spine is extremely complex. When patients come to see us, all they're thinking about is, I've got neck pain or low back pain or some kind of pain. So we're just going to use the circuit panel as an example of how that relates to the spine. So think about this for a second. Let's just say on the list here, so when you fill out your paperwork and you say, yeah, main reason, I got neck pain and left shoulder pain, and I've got some lower back pain. So I go and I look on your paperwork and you've got 1, 3, and 5. So I know that, 1, 3, and 5, that's your neck pain, your shoulder pain, and your low back pain. Right there, 1, 3, and 5. But then I go through the rest of your paperwork and I start to play my investigative self. I like to dig deep. I like to find out what's actually happened to your spine over the course of your life. And I'm in a basement right now. I'm going to go back to the office and record some stuff there. But I want to continue with this example here. And so you put on there, you got neck pain, low shoulder pain, and low back pain. But then we find out that since you were born, you've been constipated for the last 15 years, and you're 15 years old. You've got headaches. You don't sleep properly, you're moody, and then we start checking off all these other boxes here, and by the time we're done, maybe the power's, maybe the power's not off, but maybe there's dimmer switches here. So let's go back and think about what actually happens. So the spine has two functions. The first function is it keeps us upright. That's our posture. That's what we have such a dramatic change in changing our posture. The second function is it protects the spinal cord. And we're going to say that this is the spinal cord. So the spine protects all the power outlets, which is the spinal cord and those nerves. And so the spinal cord is essential for overall health. Let me explain to you why. So the brain controls every function in our body. Well, in this particular case, we got the master switch here. If I flip that, the whole power of the house goes off. We're going to call that the brain. So the brain controls every function, every cell, every organ, everything in our body. It does so by sending energy down that spinal cord. So that spinal cord is like a river carrying this life force energy. And it's energy, it's electrical impulses running down the spine. Now, I'm going to pause it for a second there, because we know of certain testing that we do in the medical world to test for electrical activity in our body. One, an EEG, right? When we do a brain map, we're checking for electrical activity in the brain. An EKG for the heart, electrocardiogram. We're checking electrical activity of the heart, right? And then we have an EMG. We're checking electrical activity going through the muscle tissue, going to the nerves. So the speed at which information travels through those nerves can be anywhere from 150, I'm ballparking, 150 to 300 miles an hour. I mean, that's fast. So there are different tests that are used to determine electrical activity. But when it's so subtle, so let's go back to the analogy here. The spinal cord brings this energy to every tissue and organ in our body. Every tissue is totally dependent on that energy to keep us alive and well. It gives us our vitality, makes us feel like we're kicking butt. You got that? Now, through stresses of life, it doesn't matter if it's from the birthing process. So a prime example, babies do 3 things. I got this right today, 3. Eat, poop, and sleep. It's all babies. That's what they should be doing, right? Eat, poop, and sleep. And so if there's a problem with that from day one, those vertebrae can be subluxated, can be shifted out of place, putting pressure, like a dimmer switch on the circuit. I'm not saying the circuit is completely off. I'm saying it's turned down. So the energy is turned down. It blocks the energy at that level, and so the energy can't get through the nerve to the organ at the end. So the organ at the end of that nerve is starving for the energy. It's going to eventually weaken and lead to disease. Hence you have people that have been constipated, diarrhea. I don't care what age they are. It's all over the board. Are you with me so far? So what happens is when those vertebrae shift, it can be an individual vertebrae, like one segment here, or it can be whole sections of spine that get shifted. And a whole section of spine can be this. My head is shifting forward. My forward head posture is putting extreme pressure on my spinal cord. So you have individual vertebrae or you have whole sections of spine that get shifted. And so what happens when our posture gets shifted, it weakens the rest of the structure. And so when we show you your posture, when we show you your x-rays, it's never just one area, right? So you might have an individual segment like this. You might have a whole section of spine that's shifted. And when that section of spine is shifted, the spinal cord is under stress, okay? And when the spinal cord is under stress, it affects every organ in our body. So it's kind of like we've got 200 amp service coming into this panel here, 200 amps. When there's stress on that spinal cord, we got 175. So now we got less power running the house. So when I talk about, I'm going to go back and show you some x-rays and some different pictures from the office. But I want you to realize this. In 1921, a group of MDs, Dr. Windsor and his group, did research on 50 cadavers. So they were doing some science research studies. They found out of the 50 bodies that they were researching, a total of 139 diseased organs were discovered out of those 50 cadavers. 100% of the time. Not some of the time, part of the time, 75, 100% of the time. Every diseased organ was traced back to the power supply. Every diseased organ was traced back to the power supply, which means, in this case, the spine at that level. So I'm going to show you a couple different cervical x-rays, just some pictures of some cervical x-rays. So think about it. There's your thyroid right here, right? There's your thyroid. We've got our neck right here. Wouldn't it be logical for this part of the spine to control the organs right here? Right? That would make sense, right? I'm not going to have my thyroid be controlled by my, you can't see my low back, but you're not going to have my thyroid controlled by my low back or my tailbone, right? It doesn't make any sense. It's controlled by that same area here, and you'll see on some of the diagrams, right? So we're going to show you when we see a lateral x-ray, a lateral neck x-ray, cervical x-ray, and we see thyroid, we see the thyroid. We should not see it. It's soft tissue. But that means it's calcified, which means there's already been a decrease in pressure at that level. Your body never makes a mistake. It's always 100% correct for the environment that you put it through. So, I'm going to go back. I'm going to switch gears now. We're going to go to a new I'm going to go back to the clinic, but I wanted to use this an analogy here. So, stay tuned. Welcome back, and here we are back at the clinic, and I want to show you a couple tools we were talking about before. And obviously I did a video on the instrument gun and how that works. But today we're talking about how the circuit panel is a great analogy for how power gets decreased throughout our spine, and every single tissue and organ in our body is totally dependent on that energy. So what I have here is a couple of things that electricians can use to determine if you're doing wiring, right? So you'll hear if it's a hot wire or not, right? If there's power going to the wire, you can use this little tester. You can plug this into an outlet to make sure that it is connected, wired properly. You get the light, the two orange lights that show up that it's properly connected. In worst case scenario, if we're doing some investigative work, I can use a volt tester here and testing. So what you will see here is what I did is you're going to see a chart. So this is the chart here. See if I can get this to tilt down. So this is the chart. I'll show you a better picture of this, but this is the chart and this is the spine. So you'll see a separate picture of the chart itself, but imagine this now. Imagine that every time that you are on the table, that this is what I imagine. I feel your spine here, right? That's what I do. I'm feeling your spine here, but the corresponding organs are all down this side here. And so when I'm going down and I'm asking you questions, talking about your GI system, talking about your headaches, this is like the circuit breaker panel. This is what's describing what's happening. So imagine if I was palpating your spine, right? And I go down, and if I could use one of these tools, right? That'd be pretty cool, actually. If I could use one of these tools. Oh, wait a minute. We do have a tool. This detects in real time the frequency of the vertebrae. So the stiffer the vertebrae is, the less it moves, the less energy coming through that vertebrae. What a novel idea. It's awesome. But let's go back to my analogy. So imagine if we could just use this guy here to figure out, as we're going, before I adjust you, if I just go up, down each vertebrae and say, oh, we got a little bit of lack of power here. How's your GI system been working the last couple of days? Well, I haven't. It hasn't been. I've only gone to the bathroom twice this week. So, so this is what it's all about, is restoring the energy to the spine. We do that through adjusting. By adjusting the vertebrae, here's what takes place. By adjusting the vertebrae, we're restoring that nerve signal. We're freeing up that vertebrae to move properly. When we're doing traction on you, we're trying to get that vertebrae to be in a more stable position to allow the energy to come through. Because the more energy that comes through, the more it affects this entire spinal area here, right? So the more energy that's flowing through the spine, guess what you feel? Oh, I've been sleeping better. I've been feeling better. I haven't been as cranky. I'm less irritable. People actually liked me yesterday. I was actually funny yesterday. So, I've gone to the bathroom. I haven't had to go to the bathroom. I mean, whatever the situation is, You're losing weight. I mean, just look at all the different things on the list and all the different organs. And the goal is to supply the organs with 100% of the energy that they are required to have to function normally. And so I thought this was a pretty good idea, putting the spine down on the chart so you could see. This is how I look at it, is when I'm going through here and I'm palpating the spine before I actually adjust you, I'm thinking, or when I'm looking at your x-rays, right? And then when I look at your chart and I see all the things that you've highlighted on the chart, right? And then we look at your chart, your x-rays, your balance, your vestibular system, which is up here, right? Your sex organs down here, right? Everything. Lung tissue. Oh my gosh. There's a whole nother topic we could talk about. Lung tissue, compromised lung tissue, breathing, especially in this COVID environment. So anyways, I hope this helps, because imagine if I could do this, right? So if I'm going to take a little detector, whether it's a voltmeter tester or whatever it is, and we're going to go down each vertebrae and check each vertebrae like this. And then I'm going to go down and I'm going to grab, sorry, I'm a little tangled up here, but I'm going to grab my instrument gun here, and then we're just going to go down the spine, and we're going to get that vertebrae to move properly, right? So, that feels good. Oh, that feels good. So, imagine it. Oh, yeah, that feels good. That's the spot, Doc. That's the spot. And it's amazing. When we get to the spot, it's like, oh, yeah, okay, that's the spot. So, anyways, hopefully this analogy over the circuit panel starts to give you a different mindset that every tissue and organ in your body is controlled via the brain, via the nervous system, by the spinal cord. And your spine's one of the two functions is to keep an upright posture, but more importantly is to protect all the energy supply that goes to the organs, and it does so by protecting the spinal cord. So, like our channel, subscribe to us, turn on notifications, and as we empower you to live your best day every day, we want to keep the power turned on so you can have a great day every day, not just once in a blue moon. So stay tuned for our next show. Stay tuned for what I've got to share next time. I never know where the inspiration is going to come from. This was from a patient from this week, this inspiration. This was on my list, but she inspired me to get this done this week. So if you have anything that you'd like me to share on video, or a better explanation, or different things, please share with us. Send me an email, and we'll put it on the list to do. Until next time, have a fantastic day.